Looking through the lens of EFT,
Mm-hmm.
how do you conceptualize the good life?
So you mean to say, what's ideal? What are we working toward? Or yeah. Well, we talk about it in terms of both emotional health and emotional intelligence, I guess. And so it's being able, I guess someone would be leading the good life if they were able to be honest and open, and able to access their experience and their emotions at any given moment. So when they're feeling sad, or they're feeling angry, or they're feeling shame, that they're able to articulate that, perhaps just to themselves, and then have some sense of control over when they're going to express that. So if it's a close relationship, then they may want to express the sadness or the shame, if this is somebody that they feel is loving or that they can trust. On the other hand, if this is not somebody who is safe for them, they need to be able to access those emotions still, and to symbolize them, but maybe not express them because it's not the right place to do so. So I think it's emotional awareness is what I'm kind of saying, I suppose. But that has a very particular kind of meaning. So.
Okay. For a lot of the people that we watch in are students, or maybe people that aren't real familiar with
Mm-hmm.
EFT. If someone was interested in becoming an EFT therapist and getting more of a focus
Mm-hmm.
along that line,
Mm-hmm.
what suggestions would you make?
Well, actually, to contact me. That would be a good start. We're beginning to run trainings and doing workshops, and teaching people, that teach people really sort of the specifics and the how-to of emotion-focused therapy. Les Greenberg up in Toronto also runs workshops that are ongoing. And so, people can contact me or contact him, or, to be able to get into the network.
Okay. Do you want to tell us a little bit about your latest book?
Okay. Well, this is Emotion-Focused Couples Therapy, and the subtitle is The Dynamics of Emotion, Love, and Power. And what we've done here is we're really building on the existing model of emotion-focused couples therapy, developed originally by Les Greenberg and Susan Johnson. But we've expanded the model, so it's a 5-stage model, and we focus on 2 major processes that go on in couples therapy, and those are the attachment processes and the identity processes. And the identity processes, I suppose you could call it the new piece, in the sense that it's the new piece that we have developed and worked on. And that has to do with working with issues of self-esteem and identity and dominance. And so we're really working with those 2 axes, both attachment and identity. And we also talk in the book some about helping couples with self-soothing. So we say, ideally, it's best if your partner can soothe you, and when we work with couples in therapy, we try to engage partners to be able to take care of each other and protect and soothe each other. But there are times when the other is not available and can't be there, and it's important for people to learn how to take care of themselves and soothe themselves. So we're always working with that dual process of self-soothing and other-soothing. And particularly we find with more dysregulated or distressed couples that those self-soothing processes are very important to help them, as well as the other soothing processes. So that's what... And we also have chapters working with how to work with specific emotions like sadness and anger and shame and love, and in the book as well.
Well, and also, I guess kind of on the same line, as far as when I asked you about with new students wanting to find out about EFT.
Yeah. Mm-hmm.
What would you say? It's going to be kind of an abstract or open one. What would you say to newer people that are looking into humanistic psychology?
So sort of like students who are looking across the field and saying, where do I belong?
Mm-hmm.
And what I tell them is, At this point in time, I don't think that the humanistic therapies are the mainstream therapies that are being offered out there, and I think people are probably familiar with that. But that if you are looking for an approach that really deals with sort of the in-depth kind of emotional processes that human beings confront, the suffering, anxiety, and you want to sort of really delve into that and work with people at a very kind of core level, that and meaningful level, that this may be something that really interests you. It's a very dynamic field, and there's a lot of depth there. So I think it's great, So people, I find that when people learn about it, and sometimes it's an issue of education, people are just not as familiar with it, but that students of mine, once they find out about it, they get very impassioned and very excited, and they feel like it's something that can be really helpful and healing to people. So that's what I would tell people.
You mentioned that that humanistic is not really one of the mainstream. So what do you see as maybe some of the barriers, some of the things that we need to be able to come across?
To help it get more known, or well, I mean, there are just a lot of forces. I think you're talking about insurance companies, right, and sort of the push towards trying to have shorter term, quick fix kind of therapies, and that insurance companies look for that, and so people feel sort of compelled to offer it. I think some of it is an issue of education, and it's about dissemination, and people need to find out more about it and to get to know more about it. I think emotion focused therapy is, like I said, one of the therapies that we've established empirical support for it, for depression. Now we're working on that with other types of disorders like anxiety. Eventually we're developing the theory toward eating disorders. And I'm not saying it's the therapy for everything or it's the panacea, but just that it's in development. And so it seems like when people see somehow that these therapies can be effective, then perhaps that influences them. So I think that work needs to continue in that area.